So this is a video about medication therapy management, its significance, prevalence, and efficacy of this Medicare program. I found out about it while researching about the senators in our community or in our state. I'm researching about Kay Hagan, who supports this program. It was interesting to me because it helps with the older adult population a lot. Based on my research, the drug-related problems are very frequent among older adults receiving outpatient care. Outpatient providers don't really have structured programs to accommodate geriatric needs and assist seniors with managing their medication regimens. There is a big concern about polypharmacy and how these medications interact with each other and could cause problems to the older adult. There's a lot of considerations that need to be made when you're much older, like 65 and older, and most of the drugs prescribed usually have an adverse effect, and they already in itself interact with each other, so there's a lot of the individuals in this population that don't really know how their medications work, or they basically know what it's for, but don't really understand how it affects their body and why is it very important that they take it, or some of the medications that they take they don't really need. The medication therapy management program was developed through the Medicare Prescription Drug Improvement and Modernization Act of 2003 to increase the seniors' access to medications and improve their quality of care. It was designed to improve quality and safety of medication use and optimize health outcomes for targeted beneficiaries with high medicine needs. In January of 2006, this entitlement program was expanded to offer seniors and people living with disabilities the option of purchasing a prescription drug plan, which is now called the Medicare Part D. This basically helps the older adult to get their medications at a reduced cost, have somebody help them with it. Ideally, this medication therapy management has the older adult working with a pharmacist who will periodically come to their home or call them and discuss about their medications and tell them and interact with the provider as well, and let them know that the patient really doesn't need this medication or it's interacting with this other medication. It also helps the older adult know more about what they're taking and why they're taking it, because ideally this program helps, gives the pharmacist the chance to talk to the patient about it. They can go over the drug use, the side effects, what to look for, what to avoid, that kind of stuff. And I think that this is a very good program to have, but according to my research, there's a lot of research left to do about it. There's a lot of studies that need to be done to find out how best to get this out in public. There are small communities that have tried this program, and it's proven to be somewhat effective. There's a program called the Senior Pharmacist Program in one community. They do financial assistance through pharmacy reimbursement for medications on geriatric drug formulary. They also do staff communication with prescribers and dispensing pharmacies. They tailor referrals to community and governmental programs. They do periodic review of participants' medications by program pharmacists. So this is all that I've mentioned previously, and having all of these has found to help the older adult be more compliant with their medication regimen, have less visits to the ED, have less hospitalizations, take better care of themselves, have more accountability for their care, and it also has helped the ones that have caregivers. It helps them too with helping the older adult be more compliant. They have a better understanding of what is going on and what they need to do about it. I found out that the program is being widely used by lower income older adults. However, the way that it's being delivered to the communities is varied. There isn't really one specific program that uses a particular framework. There's many different frameworks out there right now, and there's only very few of them that have proven to be the most effective. This senior pharmacist program seems to be a pretty good conceptual framework, and have proven to be the most effective so far out there based on my research. And I think that a lot of the other communities may need to adopt this framework that they're doing, where they actually reach out to the older adult and have designated pharmacists to do this education. It's mostly really education. The studies have shown that older adults living in communities who participated in this program had significant reduction in the number of self-reported hospital stays and ED visits and improvements in health status. The program to assist seniors with limited income was associated with significant reductions in hospitalizations. I've already said that. There is a need for more studies to be conducted about the therapy, so we can help improve on the delivery system and be able to more successfully implement the program. I think that if there is a way to get this done and out there, I think it'll really help the older population get better care, come to the hospital less, because they're probably likely to keep going back if they don't get the care that they need, and the hospitals aren't really the best place for them because they're just going to end up with more problems. I think that this is a wonderful program to look into, because there really is, based on the research, with an increased age, an increase in the number of chronic illnesses, when you have decreased health, this is associated with an increase in the number of medications used. And so the older you get, the more meds you're taking, and the more help you're really going to need, because everything eventually just gets so confusing and so overwhelming. So it really helps to have somebody important, or somebody who's knowledgeable about these things, helping you out. So I hope that you learned something about this medication therapy management, because I really think this is a pretty awesome program.